Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Hello, everyone. Today I am talking about light therapy for eczema relief. And this is a question I get a lot. Does red light therapy help? Does blue light therapy help? What about far infrared? What about near infrared or UVB? So today we're going to break all of that down for eczema people. I want to let you know, what is the science behind all of these different light therapies? What's the difference between all of them? And how can you use them to help with eczema relief, both immediately and for lasting relief? So I hope you're going to join me today so that we can really break this down. All right. So first of all, what are the different wavelengths and how do they affect the skin? So when we're talking about blue, red, near, or far infrared light therapy, we're actually talking about different wavelengths. And blue light is between 400 and 495 nanometers. And this primarily affects the skin surface. This will affect the inflammation on the surface of the skin and then bacteria as well, too. So this can be really helpful in an eczema case when we're thinking about infections like Staph aureus or even in acne patients. Red light therapy is between 620 and 700 nanometers. And this reaches a little deeper into the dermis or the skin to stimulate healing and cellular regeneration. Near infrared light is going even deeper, 700 to 1200 nanometers. This penetrates even further, targeting muscles and deeper tissues to reduce systemic inflammation. And then this also supports tissue repair. And finally, we have far infrared, which is 3,000 to 100,000 nanometers. And this delivers thermal energy into the skin and the underlying tissues. And this really improves circulation, it reduces stress, and these can be triggers for eczema. So each of these different wavelengths of light are going to affect our eczema differently. And so we can use these different wavelengths at different times in our healing process and for different reasons. So let's break that down. So blue light therapy, one of the main reasons I like to use blue light therapy is to kill bacteria. And there are studies that have shown that blue light can kill Staph aureus, and this is a common bacterium that is found on the skin that can really trigger flare-ups and worsen inflammation. And as a lot of us eczema patients know, we know that staph infections are something that might happen frequently. Blue light therapy can really help for this. But that's not the only thing. Blue light can also reduce inflammation, suppress those cytokines that cause us to be really itchy, like interleukin 4, interleukin 13. And these are really key drivers that, even our medications like Dupixent are targeting. So blue light therapy can be a really safe alternative for this. And you can also be supporting that skin barrier by doing both of these, right? So if you're keeping those infectious bacteria low and you're reducing the inflammation, that's really going to support a strong skin barrier. So blue light therapy, I really do like because the safety profile is pretty high. And there are some studies that back this up specifically for eczema. So a 2016 study published in Dermatology demonstrated significant reductions in eczema severity after blue light therapy. And most importantly, there were no adverse effects reported. And this just highlights how safe blue light therapy is. And it's a really great adjunctive therapy to add into your healing regimen for eczema. There was also another study that was published in PLOS ONE that highlighted blue light therapy's ability to improve eczema symptoms, including the reductions in itchiness and better sleep quality. So I like blue light therapy for eczema because there actually are specific studies that do back up this therapy for eczema. And we'll see some of these therapies don't have specific studies that back up the therapy for eczema, but they can back up some of the root causes of eczema. So I do like blue light therapy because we actually do have some research behind this. All right, moving on to red light therapy. How does this work? Well, red light therapy goes a little deeper, as we said, and it can boost cellular energy. That increases the little batteries that are in your cells that are creating the energy, fueling cellular repair and regeneration of your cells. So, this is really important because when we have eczema, we're creating a lot of wounds on our skin when we're scratching, and we need that cellular repair so that we can heal faster. So, my patients often tell me, oh, Dr. Fong, I know that I'm healing now because I'm just healing so much faster. Like I might have a flare, but then I heal so much faster. Red light therapy can speed this process up. It also reduces inflammation as well, lowering pro inflammatory markers like tumor necrosis factor alpha and interleukin 1 beta. So, we're also seeing that inflammation process being lowered by red light therapy. Collagen can also be stimulated, and that's the same thing as boosting the cellular energy. Not only are we boosting those cells to heal, we're also boosting the skin's ability to create that collagen and rebuild that barrier because that's really important. And then we're also improving that blood flow to the skin. It allows more oxygen to be delivered to the skin, allowing more nutrients to be delivered so that the skin can heal faster. Now, one thing that I have noticed is sometimes, using red light therapy is amazing. And then sometimes it can cause a little more inflammation when people are maybe a little bit too inflamed at the very moment. So it can go either way. And sometimes it's also the length of time that you're actually using the red light therapy that can also matter too. So I do sometimes like to use red light therapy when we are more in the healing process of the skin. And so for eczema, there's different stages that we go through. We have that really high inflammation. Then we might have that stage where we are flaking and that redness is coming down. And during that phase, it might be really great to use something like red light therapy to really help that regeneration of the skin. And then if we're going to think about using blue light therapy, we might be thinking about that when we are having flares, especially if those are being caused by infections like Staph aureus. Okay. So there's different reasons to use these. And so I will use these throughout a treatment plan from start to finish. I may actually use different types of light therapy as we're going through the process. Now, there are some studies that have been done for eczema specifically in red light therapy. So, a clinical study reported 79% of eczema patients experience a reduction in itchiness, and 71% saw improvements in rashes after undergoing red light therapy. And then there was an animal study that was done in 2021 that demonstrated that red light therapy at specifically 650 nanometers significantly reduced skin inflammation, skin thickness, itchiness, and mast cell counts in subjects with atopic dermatitis. Now, mast cells, these are immune cells in your body that release histamines and release all these inflammatory factors that cause you to be more itchy. And so often in an eczema case, we're seeing that there are high histamine levels. So that can be really important. The researchers from this study concluded that this treatment might be an efficacious, safe, and steroid-free alternative therapeutic strategy for the treatment of atopic dermatitis. So this is a wonderful, again, safe treatment that we might want to think about when we're thinking about our eczema treatment plan. Then there was one more study that was done where they saw that a combination of red light therapy and herb called curcumin, or it's actually from turmeric, and curcumin is actually the active component of the turmeric. Now, this is an anti-inflammatory herb that helps lower inflammation, produce the best results. So what it can show is that red light therapy, along with anti-inflammatory therapies, can actually be helpful for each other, supportive for each other to lower that inflammation. And they did notice that it was more beneficial to use them together than either of those alone. So using curcumin alone or red light therapy alone, they saw a benefit when those were used together. Now, the next type of light therapy is called near infrared light therapy. And this one's a little different. We don't necessarily have very specific studies on near infrared light therapy and eczema, but we do have some research that shows that it can help some of the root causes of eczema, like inflammation, and it can support things like detoxification and tissue repair. And as we know from previous episodes, that toxic burden is a big part of eczema, inflammation is a big part, and then, of course, that leaky skin. So, near infrared light therapy can be helpful. And there was research published in the Journal of American Academy of Dermatology that found that a combination of red and near infrared light therapy improved tissue repair and inflammation. So I do really like a device called the Mito Red device, and it actually has a combination of near infrared and red light therapy. So I like using those together. Sometimes I will actually ask the patient to use the red light therapy first, and then when things are getting better, add on the near infrared light therapy. A reason for that is it goes a little deeper. It can stimulate a little bit more. It's a little hotter, so the patient may tend to sweat when they're doing the near infrared light therapy. And of course, as we know as eczema patients, when we're sweating, we get itchier and sometimes it's a little more difficult. So I sometimes have them use the red light therapy part first and then later combine the red light therapy with the near infrared light therapy. All right, moving on to far infrared light therapy. Now, far infrared light therapy is the same thing. There aren't many specific studies for far infrared light therapy alone to support eczema, but if we're thinking about what far infrared light therapy does, it can target those root causes of eczema. So it improves circulation, it reduces inflammation, it supports the skin barrier repair, and it reduces stress. And as we have talked about before, stress can be another one of those big root causes for eczema that we need to address. So there were studies that kind of showed that all of these things are demonstrated, in clinical research. So a study published in Biomedical Research demonstrated that far infrared light therapy improved wound healing and reduced inflammation by enhancing blood flow and cellular activity. And then there was research also that showed that far infrared improved skin hydration, elasticity, and barrier repair, and lowered cytokines, including TNF alpha and interleukin 6. And finally, there was a study that showed that far infrared light therapy reduced stress and improved immune balance. So there's a lot of research actually for all of the benefits of far infrared light therapy. And actually, there are more benefits, cardiovascular benefits, etc. But today we're more focusing on the eczema part of things. Now, far infrared light therapy, you're often going to hear of it as a far infrared light sauna or a far infrared light sauna blanket. And so the reason for this is because it's going to go deeper. You are going to get hotter when you are doing this therapy, and it is a sauna therapy. And so, I do, again, like to reserve this type of therapy for later in the process because, as we know, in the very beginning, eczema patients are often so itchy, so uncomfortable that this heat may not be helpful for them. And I remember when I had really severe eczema, it was really hard for me to get into a sauna. Nowadays, I love getting into a sauna, and it's when those toxins are really overflowing in your, what I like to call, again, your detox funnel. And I refer to that a lot. And when you have so much inflammation on your skin, sometimes that heat can actually increase the inflammation, even though there might be processes that are lowering the inflammation with the far infrared. Sometimes it's just not right to use at the beginning of the process. Okay. So, even though I'm saying, yes, this is great for eczema patients, it may not be right for you if you're having a really moderate to severe situation. And we might need to do more healing of the root causes before we actually use the far infrared light therapy later on in the process to really help with the detoxification and healing process that we might do later on in the process. And for me, detoxification is actually phase 3 of a support system. And we always have to start with the core organs, the core deficiencies, the nutritional deficiencies. We have to support those drainage organs. And then finally, we have to go ahead and cleanse the system. So I like to use this in that third phase. Okay. Now, how does this differ from UVB therapy? So maybe your doctor has told you about this type of therapy. It's called UVB therapy. This is a little bit different. UVB rays are doing two different things. They're actually suppressing the immune system and they're slowing skin cell growth. And so UVB reduces the activity of those immune cells, such as your T cells. And so this can really help lower that inflammation of eczema. And then it decreases that rapid production of skin cells, which causes the scaling and the plaques that you might experience with eczema. So it can help to alleviate some of those symptoms when there's a really moderate to severe, condition. But there are some risks. There is a risk of DNA damage, so that ultraviolet light can cause mutations in skin cells and increase the risk of skin cancer. So this is just kind of like going out in the sun and not wearing sunblock. It's like going in a sun tanning bed, and not wearing sunblock. And so you're getting that UVB direct to your skin. It can cause premature aging. So prolonged UVB exposure accelerates that aging process. Again, it's just like being out in the sun too much. And then it can cause some short term side effects like redness, sunburn like reactions, and increased sensitivity to the sunlight, because it's basically like you are sun tanning when you are doing this treatment. Now, there are reasons why we might want to choose these other light therapies because they don't come with these risks. The red, the blue, the near, and the far infrared are not ultraviolet, and so they are non damaging to your DNA. And so that eliminates that risk. There are a lot of holistic benefits as we broke down. So it's not just about healing the skin, superficially. What's happening is actually lowering the inflammation and, decreasing stress with these other types of light therapy. And then it really does promote that skin barrier repair because we're stimulating mitochondria, we're stimulating collagen, so we're doing this in a very holistic way. It's very safe for long-term use. So you can use these, for a lifetime if you want. And actually things like red light therapy are used for anti-aging, and even the infrared saunas are great for anti-aging. And these therapies can actually be complementary to the other things you're doing. So, there's not necessarily any contraindications, although there are some contraindications with certain diseases and certain medications. So you want to look into that. If you are going to be thinking about these light therapies, just make sure you're checking in with your doctor. Okay, so what are my recommendations? Well, I wrote a blog on this topic, so definitely check out the links in my description for the blog because there will be links to all of my recommendations here. I like red light therapy in lots of different ways. So if it's primarily on your face, you might want to get a face mask. I do really like the Mito Red because it's not just red light therapy, but it's a red light plus near infrared light therapy. And I will show you what my setup is at home. I have both a face mask and I have a pretty intense setup at home. And then you can also there are handheld light therapy machines that have both red and blue, and you can switch between those, especially if you're having infections on your skin and you're worried about staph infections. You can go blue, and then afterwards you can go red. You could do 5 minutes and 5 minutes daily, something like that. And then there are full body machines that are for red light therapy, and I'll show you what mine looks like. There are full body machines for the far infrared. There's far infrared sauna blankets, far infrared saunas that you walk into. I actually have both of them. There's also PEMF mats, and we didn't talk about PEMF or pulse electromagnetic field therapy, which I also love, and I'll probably do a separate session on that. But there's PEMF mats that have infrared in them as well too. So you can check out all of those recommendations in the blog that I wrote. And if you have any questions, definitely just comment on the blog, reach out to me. You can DM me on Instagram at drfong.nd, and you can ask me any questions you have. So this is my setup at home, if you guys can see it. If you guys are listening to this on the podcast, what we are looking at is we are looking at an elliptical machine. So I've got an elliptical machine, and I actually have my red light therapy machines kind of flanking my elliptical machine. And I actually wear goggles when I do my elliptical machine. I turn on the red lights, and I do this for 20 minutes every day. And this is a great way to get both the red light therapy, the near infrared, and get my exercise. And because it's getting colder, it allows me to get some of the healing benefits of the sun because I'm not going out in the sun a lot. And it feels like that. It kind of feels like I do it on an incline. So it feels like I'm, trudging up a mountain in the sunlight. It actually feels really great, really energizing. I feel really awesome after I do this. So you don't have to have this setup, but I just wanted to show you what my setup looks like. And, it is quite an expensive setup. So, you don't need all of this, but these are the Mito Red panels. So you can actually get mito red panels that are going to be encompassing your entire body. You can also just get panels that are smaller, if you're concerned about cost. And then you can just rotate the areas that you want to put the red light therapy on. I do typically recommend that you start with just, 5 minutes in each area, or even 1 minute if you're very sensitive. And then you can go up to, 15 to 20 minutes if that's something that your body can tolerate. But I do always recommend that you build up to that and that you work with someone to make sure that you're doing this correctly and you're not necessarily contraindicating with anything else that you're doing. Thank you for joining Live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers, or download my free eczema relief guide for quick, practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. Use the code LIVE30 to enjoy 30% off as a thank you for tuning in. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.